The team huddle is an essential element in patient-centered workflow in the medical home. The huddle enables the team to manage population health, improve continuity and access, and coordinate care while reinforcing the central role of the team in the delivery of comprehensive health care. The following enactment of a team huddle highlights the 5 standard elements of the huddle in the Army Medical Home: core team staffing situation, access management realignment, visit preparation, transitions of care, and clinic preparation. Each standard element is explained in detail as the huddle proceeds. Note, too, that preparatory work was done before the huddle begins, that there is a huddle leader, that participants are standing rather than sitting, and that the huddle is brief and focused. Huddle time is scheduled, not squeezed in. It is Tuesday morning in an Army primary care clinic. The team is starting their morning huddle. The team consists of 2 physicians, a nurse practitioner, 6 LPNs, 2 of whom called out today, and an RN. The team RN pulled the action list the afternoon prior for the patients coming in today and for those patients already scheduled up to 3 days out, and has prepared a report for each core team. The RN is leading the huddle.
Good morning, everyone.
Good morning.
We have a busy day with full schedules for our core teams. Dr. Caffrey, both of your RNs are out today, so Dr. Newton, I've reassigned one of your LPNs to work with Dr. Caffrey today.
So that means that per the protocol we're red, so I guess what we'll do is you'll take care of the yellow copy forward segments of the tri-service workflow. We'll do the rest.
Yes,
right?
sir.
Okay.
So I've actually notified our clinic practice manager of this situation, so she's going to try and get us additional resources so we can bring our core team back to green.
All right, thanks.
If we should fall behind schedule, I need you guys to call a stat huddle, and we will call the other teams in to step in so Dr. Caffrey and Dr. Newton can remain on schedule. We don't want our patients to have unnecessary wait times.
Cool. Okay, great. I'll let you know. What we saw was Standard 1A, core team staffing situation. Based on available staffing for that day and using standard clinic protocols, the team determines how much team-based documentation will be supported by each core team for each clinic session.
Okay, I've reviewed the schedule for the next 3 days, and we have 60% PCM continuity on average. Our goal is 75% PCM continuity as a minimum. So I have contacted several of our patients and rescheduled them, made some adjustments, and everyone's continuity is back up to 80%. Wow. I did this by maintaining the patient preference on their appointment time as well.
Thank you very much.
So we also have 5 patients that had some recent specialty referrals, and I printed out those referrals so you guys will have a copy of them. I went ahead and scheduled a telephone consult with them rather than a face-to-face encounter, and you'll see that on your afternoon schedule. All right. Dr. Newton, Mr. Bone was going to come in and see you this afternoon to titrate his blood pressure medication. I spoke with him, and he would be pleased to see our embedded pharmacist. I spoke to the pharmacist, and she's going to go ahead and see him, and then she'll contact you after the visit and let you know if she had to adjust his blood pressure
That'll
medication.
be great. Tell her just to find me in the clinic, or she can page me either way.
Okay.
Thank you.
All right. And Ms. Hubert, your patients seem to like the secure messaging system. You have about 20 virtual encounters, so I went ahead and gave you an extra 30 minutes tomorrow morning.
All right, that's great. I'd like to take care of that.
This section illustrated Standard 1B, Access Management Realignment. Patients scheduled for the next 72 hours who are not scheduled with their PCM are contacted and realigned to maximize PCM continuity wherever possible. In addition, patients scheduled for the next 72 hours who appear to have issues that could be addressed outside face-to-face appointments with the PCM are contacted and offered appointments with other team members or offered a virtual appointment.
As all the teams can see on their 72-hour schedule, you see that? I have identified 18 preventive health visits for our clinic protocol, and I will be contacting them this morning so that they can complete their lab work prior to coming in for the appointment. So if you see anything else that we need to take care of, let me know.
Okay.
Is there anything else that we need to address?
I'm just looking. It looks like I think Mr. Hart, who's coming to see me tomorrow, had a catheterization done, a heart catheterization, I think, last week downtown, and he was going to follow up with me. I've already seen that report, and I talked with the cardiologist, and I really just need to go over the results with him. Will you contact Mr. Hart and find out, would he like me to just schedule a phone call with him, or would he actually want to come in and see me? I can do it either way.
Okay, Dr. Newton, I'll go ahead and do that.
Okay, thank you.
I do need to let you guys know that you have 32 med refills that need to be signed off this morning.
This morning?
This morning.
All right. This was Standard 1C, Visit Preparation. The team briefly reviews the next 72 hours of scheduled patients to determine if there are patients who need to be contacted for pre-visit testing or obtain key documents.
2 of our practice patients went to the ED last night, and per our clinic protocol, I went ahead and contacted them. One was for an ear infection, and they're doing well, and I went ahead and scheduled them for a follow-up checkup in 3 weeks. The other one was a 36-year-old asthma patient, Dr. Caffrey's. He had a flare. I contacted her, and she will see our pharmacist and our case manager today at 1300.
Okay.
So I was wondering if you wanted to see her after our appointment.
Yeah, if you could, as soon as the case manager or pharmacist have seen her, just have them let me know, and I'll find them, and we'll sit down and go over the action plan.
Okay, great.
The team met Standard 1D, Transitions of Care. The team manages care for patients who have had a transition of care since the last huddle. The team has identified patients who are discharged from the hospital or from an emergency room, and team members are assigned to contact those patients and facilitate and coordinate their transition. Clinic protocols and formal co-management agreements are used where applicable.
All right, so in your packet there is the clinical preventive list of all the patients that are scheduled for today. So according to our clinic protocol, I have pre-ordered all the tests except for the immunizations. So I need the LPNs to go ahead and check the immunizations and make sure that if we can get them updated during the screening.
Dr. Newton, I see that your 1400 patient is Mr. Hughes, and the action list indicates that she's due for a colonoscopy. I thought she already had some type of cancer.
You know what? I think you're right. Ms. Hughes has actually that stage 4 lymphoma, and I think she was coming in to see me for that. So you're actually spot on. We probably need to remove both her colonoscopies and her mammograms off that action list, so it won't come up again in the future. Good catch. Thank you.
All right, great. Does anybody else have any concerns or issues at this time before we get started?
Yes, I do. I have an appointment this afternoon at 1500. The OIC has already approved it.
Okay.
And is there anything that I can do to make sure they're in good shape before I leave?
Okay. Well, I just want you to be sure that your telephone consults and your secure messages are current, and then call a brief huddle before you leave, so that you leave the clinic, so that we can adjust the team-based documentation to red. And I will be sure the clinic manager is aware of this to see if they have any assets that they can give us to help from 1500 to 1600 today.
Finally, we saw Standard 1E, Clinic Preparation. Patients scheduled for that day are reviewed for any needed documentation, clinical preventive services, procedure setup, or other issues. The huddle concludes with an opportunity for team members to raise issues affecting patient care that day. Following these standards maximizes the value of the huddle in the delivery of comprehensive, team-based care.